Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have with us Dr. Harry Black. He is a retired surgeon, author, cancer survivor, now transitioning to a web based practice focusing on integrative oncology as well as overall health and longevity. So we learned about his about metastatic cancer, his metastatic cancer in 2023, prostate cancer in 2021, and the reasons about this, how these things have been, he tackled in his own way, and we'll explore the root cause approach that reversed his type 2 diabetes and helped him treat his cancer. Why organized medicine misses the metabolic signs of origins of chronic disease, and how patients can take control of their health along with their physicians. Welcome to the show, Dr. Harry.
Thank you very much. I appreciate being here.
You are welcome. Welcome to the show. Welcome to India in this online form, Dr. Harry. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll talk about tackling diseases, illnesses from the root cause itself. So we'll talk about all this and much more. But before that, let's talk a bit about your journey, your background, your story, so that the audience knows who they are listening to.
Well, I'll make this as quick as I can with this because it's kind of a long story. But I was diagnosed with prediabetes in 2011, and I didn't really pay much attention to it. And then it worsened. I got more medication given to me. And finally, in 2018, I was diagnosed with a full-blown type 2 diabetes, and my hemoglobin A1C, which is a marker for a 3-month look back at average glucose, was very high, the A1C. And so I had to readjust everything in my life. I read a book by Dr. Jason Fung called The Diabetes Code. And with that in mind, I was able to work on it. And I got my A1C back down to what was then pre-diabetes. And since then, I've worked more and now I'm not diabetic. And we're not supposed to be able to do that according to standard medicine. But you can, and I proved that for myself. That was in 2018-19, and then in 2021, I was diagnosed with a very high-grade prostate cancer, a Gleason 9, which is very, very malignant. And I decided to have surgery. As a surgeon, I didn't mind that. So I had a radical robotic prostatectomy in 2021, and I was clear of disease until 2023 when I had metastatic lymph nodes found on a special PET scan. And at that point, I got 2 injections of androgen deprivation therapy, which is a standard protocol for that. I did not want anything else. I didn't want further ADT, androgen deprivation therapy, or radiation, which they recommended. And at that point, a friend of mine who's a doctor sent me a couple of articles on something called graviola or tropical soursop. I also did some more research and found something called IP6 and something else called lactoferrin, all of which kill cancer cells in prostate and breast cancer particularly, and also Indian gooseberry, which you might be familiar with, or amla powder. And all 4 of those things were substances which would kill cancer cells, cause the death of cancer cells and the decrease of spread. So I started taking all 4 of those. And since then, through Dr. Paul Marik, M-A-R-I-K, and Jane McClellan, who lives in England, I've discovered this whole new world of integrative cancer with repurposed drugs, for instance, like mebendazole or ivermectin or fenbendazole, and as well as metformin, which is anti-cancer, vitamin D, atorvastatin, a bunch of things that we use for other things are actually anti-cancer. So I've discovered all those, and now 32 months after my last injection, even with this high-grade cancer, I'm still free of disease. So I don't know if I'm cured or not, but I'm free of disease right now, which is unusual with the Gleason 9. And I'm another one of the anecdotal stories, like the Joe Tippins protocol with stage 4 lung cancer, or Jane McClellan herself with metastatic cervical cancer. So there's a whole lot of anecdotal stories like this. So that and what all that does is prove that we might have other options, not instead of necessarily, but in addition to standard chemo radiation surgery.
Absolutely, absolutely, Dr. Harry. So I want to understand for the audience, what have you uh, learned uh, about the medical system while going through all these? You have been a part of the system
For
for many, many years.
for 36 years, I
What?
was a practicing surgeon. Yeah.
Of course. So, what have you learned about it? Nothing wrong about it, but to understand your understanding from that. Secondly, what did you learn about yourself, about the human body, and also about the options that are available today, as you said, alongside with the modern side science that can work and help for a lot of people today. Help us with that, so that a lot of people who may listen to it later on, also even now, they can find something that they can find beyond what is available for them today or even tomorrow.
Those are great questions. They're just great questions. Starting with the system, the American system, and I'm sure it's many places in the world, is based on longitudinal science, meaning cause and effect, and it's run to a large extent, as everybody's heard, by big pharma, meaning. In the United States, there are about 250,000 medications. Only 1,000 or less actually cure anything, and most of those are antibiotics. Everything else treats symptoms. All the diabetic medicines don't cure diabetes, they treat symptoms. They can bring your blood sugar down, but they don't take care of the disease. You have to get to the underneath all that. So, and what I've learned about myself is that the body is very resilient. We are built to heal. We are created to heal, and we just have to provide the infrastructure for it. And what that means is it's not just supplements, it's nutrition, it's proper nutrition, not uh, ultra processed foods or damaging seed oils or things like that. But it's proper nutrition, but it's also proper sleep, 7 to 8 hours of sleep a night. It's proper exercise, not just aerobic exercise, 150 minutes a week, but resistance training, weightlifting. That's one of the keys to longevity is actually lifting weights because it helps everything in your body, insulin resistance, it gets your sugar under control. It also strengthens your bones, and it is overall just very necessary. And I started doing all those things, as well as a spiritual component, whether it's meditation or prayer or however people want to do it, the quiet time where you connect at a deeper source within ourselves, within our souls, and all of those things play together. In addition to family and community and the love that surrounds us in that situation, to provide a different way of living life than what we've come to know in this modern world. So all of those things play into healing in general and cancer in particular. And the American system, well, it's broken right now. We spend more per capita in this country. I think it's about $1.6 trillion a year, more per capita on healthcare than any other place in the world. And yet in the Western world, we're like 25th in length of life and also health span. And that's just wrong. It's just wrong. And it's too algorithmic, meaning we react to things like diabetes or high blood pressure in a very algorithmic way. Do this, then this, then this, and this, rather than saying, well, what caused this in the first place? And getting back to the root cause, it's cellular inflammation, meaning the cells are broken at the mitochondrial level. The mitochondria are the powerhouses of the cell. So if we start to understand that and start to get to the root cause of it with the metabolism, we can fix it. And I just offer myself as an example of that. I'm nothing special, but the secret is you have to take control of your own life. I dieted for years. I gained and lost weight for years, but it wasn't until I started concentrating on my health that the weight has come off and stayed off because I'm trying to be healthy. I'm not eating. I'm eating to live, not living to eat, and I'm much more conscious about what I put into my body.
Absolutely, absolutely, Dr. Harry. Did you talk about your, recovery and all those things to your friends within the medical fraternity? That a lot of patients come to them for their advice on such matters, and that there are answers outside, like the answers that you got for yourself, that the same answers can work for millions of others if doctors become part of that, include those
I
things
agree.
also into what they are doing. This will improve the, whole, uh, you can say, parameter of the cure, or options that you are offering to the patient. They will be grateful for this, because they are going to the doctor. They think the doctor will advise everything that is available on this planet for them. how
I
how how was your experience about these things?
Well, it's an ongoing experience, honestly. Some people roll their eyes at the physicians, and some other people say, "Yeah, I'd like to be able to do that, but I don't have enough time to spend with the patients." Because actually, to do something like this, to help somebody transition into an attitude of health, it takes time to sit and coach them through it and talk about it and follow it. And most doctors, at least in the United States, don't have time to do that. So it's one of those things where people, I think doctors want to do it, but they don't feel like there's a platform for them to be able to, because insurance doesn't compensate people for supplements. It doesn't compensate doctors for the time that they spend in doing that. So the whole system has to be retooled. And I think what you're getting at is that yes, people have to start asking for that, the patients do, and the doctors have to start responding to it. And if they don't, the approval rating of doctors is going to go down. Only 39% of Americans trust their doctor now. That's the lowest it's ever been in the history of testing that. Doctors have usually had a greater than 90 to 95% trust rating, and now it's less than 40%. And I think it's going to go lower unless doctors and the medical community in general starts to wake up and start to look at it from this standpoint.
Absolutely, absolutely. Then who is going to do it? Will the patients have to do it themselves? Because then it's a very lonely fight, and it means you are losing trust on the system, which may be benefiting today, all the maybe perhaps the medical industrial complex, whatever reasons, or even for the doctors. To be fair to doctors, they might be also afraid that the patients may not follow the extra advice in the right manner, and that can lead to problems for
Exactly.
them also in the wider sense. And that is why they just stick to what is medically proven, and just stick to what the prescription is. How
That's
do you,
spot on.
whatever it is, how do you move forward beyond the present status quo, because patients are suffering?
They are, and I think the answer is one doctor and one patient at a time. I can only deal with a certain number of patients, but there's more doctors who are starting to feel this way. I've talked to 5 in the last 2 weeks who are going to transition their practices to something like what I'm doing now. And I'm not going to do primary care. I'm a surgeon. I'm an integrative healthcare provider in my own mind right now. But other doctors are going to be more into the primary care, but they're going to transition. So I think it's got to come from the ground up, and it's got to be one doctor, one patient at a time. And I'll fall back on my favorite quote these days. Margaret Mead, the anthropologist, said one time, "Never doubt that a small group of committed, thoughtful citizens can change the world. Indeed, it's the only thing that ever has." And I think that's the only answer, honestly.
You know what my thought is, Dr. Harry, at this point in time? I've
What's that?
interviewed several patients, several people who have done their own research while fighting with their illnesses or diseases,
Yes.
and they have had to do it themselves. Why can't there be a system which is documenting all the available resources, or in terms of things that have worked for other people, so that when someone has an issue with whatever related, like you did with diabetes, like you did with cancer, others have their own issues, they don't have to again do that whole start and invent their own wheel. Rather, they come to already the latest that has been discovered, like it is in the modern medical science, and straightway they can get some advice on that, and which is not going to be to impact with their present treatment, and just give them better chance of cure, better chance of survival?
I think that another great question, and I think the ultimate answer is going to be that it's going to have to evolve. We can't make a change all at once. I wish we could. I really do, because what you're suggesting is exactly where we need to be right now. Integrative care, holistic care, functional medicine, however you want to phrase that, lifestyle medicine. There are a bunch of different names for it, and there's slightly different bents to it. But it's the Wild West, as an American phrase. It's the Wild West right now. Everybody's scattered all over the place. I think over time, the science the science is actually going to support this, and I think it's going to become more well known. There's too many people out doing wild things and offering cures or something else that really aren't. But but you're right. It's going to have to change, and I think we may get there, but it's going to take 5, 10 years, maybe longer. At least I hope that's what it is, because people are going to have to demand it, and that's worldwide. We're all in this in the same boat with this, and we have to get healthy together. We have to encourage that in each other.
Absolutely, absolutely. So let me understand, what is it that you are trying to say to the people of the world? What is it that you are trying to do with what you are doing?
In one statement, take control of your own health. Learn about what it is that health is. Learn how to be healthy. Learn what to eat, how to sleep, how to be in community, how to exercise. Learn all those things yourself. There's no magic to it. You have to just do it. But that's the message: is you have to take control of your own health. The old joke was, how many psychiatrists does it take to change a light bulb? And the answer is one, but the light bulb has to want to change. So if we want to change, like I wanted to change, then it's possible. But everybody has to take control of their own health.
Absolutely, absolutely. You talked about sleep, you talked about nutrition, you talked about exercise.
Yes.
What have we to learn about all these things? We just have to unlearn social media, we just have to unlearn the bad habits, and we can have a better life. I am also guilty of that, but I'm representing right now for the general audience. What would you like to tell them about things which are so natural to our existence, which have been there, which are needed for our body to recover, to regain our strength? Why you are not able to still do it in our, for whatever reasons, excuses we may want to give in our lives?
Right. It's too easy to make excuses. Yesterday morning, I didn't want to get up. I got up early. I got the early morning sun in my eyes so that my brain could wake up, because that's what the early morning sun does. The infrared light in the early morning, right after sunrise, gets your brain working a little bit differently. I walked 4 miles at a rapid pace yesterday, and so I didn't want to do that, but I did it because I've gotten in the habit of doing it. And so it's a matter of just changing that will inside. I want to eat a bag of potato chips. If you put a bag of potato chips in front of me, I'm probably going to want to eat that. And left to my own devices, I might. But the truth is, I don't more often than I do at this point. I'm not perfect, but you have to want to do it, and that's where it is. And sleep, we've given short shrift to sleep for years and years. I'd work on 2, 3, 4, 6 hours of sleep a night, and finally, to be healthy, our brains have to heal, and our brains heal overnight in 7 to 8 hours of good sleep. So it's all playing in together.
Absolutely, absolutely, Dr. Harry. You put a lot of emphasis on, root cause healing. Take care
Yes.
at the roots itself. What is
Mhm.
it? People will understand it, but I want to understand your views on this, your understanding on this. What is root cause healing from you after the illness has happened or before it begins?
It's so multifactorial, because all those things play into inflammation. And I don't want to get too deep in the weeds with all that, but inflammation means that the cells are damaged. The basic metabolism of cells is damaged, particularly with mitochondria. Again, they're the powerhouse. They produce ATP that energize our cells, our bodies. And if we have bacterial toxins around, which we do, if we have environmental toxins like all the poisons in the air, and from pesticides and herbicides and whatever else people are putting in the atmosphere, if we eat inflammatory foods, which are ultra processed foods, fast foods, McDonald's and everything else, are fast foods, and they are ultra processed. It's not really basic food. So if we go back to eating basic food, nutrient dense, locally sourced food, then we have a better nutritional balance. So those get back to the root cause of decreasing inflammation. Inflammation is the problem, the root cause of most chronic diseases, almost all of them, including cancer. Cancer, 90% of all cancers are metabolic, not genetic. And even with the genetic ones, you can somewhat stabilize it with proper metabolism, meaning nutrition, exercise, sleep, and everything else.
Absolutely. One thing you touch upon also is the repurposed drugs. What
Hmm.
is that? And isn't modern medical science already doing it, that you had to do it in your own way and find something better for yourself? How should patient understand it? How can they talk about it to their existing doctors? How can they think beyond the modern medicine like you did it? Is there a way to do it? What is the best way to
There,
do it?
there is a way, and the way I did it, because I couldn't find it. I did all the medical research. The reason I had surgery on my prostate, the reason I had the androgen deprivation therapy was because I did the standard research. I knew how to read the articles, and I followed what the articles said. It was only when a friend of mine suggested the graviola that I started looking at the other things. If somebody's looking for something with cancer and repurposed drugs, I would highly recommend, you can get it on Amazon, Cancer Care by Dr. Paul Merrick. That's Marik. Paul Merrick. He's an American physician, and he's done a tremendous amount of research into repurposed drugs. And he's writing a Substack now that is brilliant. And I would encourage people to follow him on there, because he goes through this in depth. And become an acquaintance of mine, and I hope to develop a further friendship with him, because he's a brilliant guy and he has the world's care at his heart. So I would recommend him, and also Jane McClellan. That's McClelland. She wrote a book called How to Starve Cancer, because she survived a stage 3 or stage 4, ultimately stage 4 cervical cancer herself, and she's alive 30 years later. So there's information out there. You just have to make sure you get the right information. And those are two of my trusted sources. There's developing others, but it's a small segment right now. But if somebody's interested in it, I'm providing some of that information at my Substack and my own website now. But I'm following their lead, and just interpreting it my way, and doing it with the people I know.
Absolutely, absolutely. One more thing I want to understand about your views on this. You talk about, modern medicine, Western medicine can learn from its holistic herbalist roots and begin to take care of patients differently. What
Yes.
can modern medicine learn from its own roots and wipe all those diseases from the roots themselves, so that the world is a much more happy, happy place?
Yes, absolutely. I've come to really, I haven't learned as much as I want, but I've learned a lot more about Ayurvedic medicine, that is from India. It's amazing how accurate, from thousands of years ago, those early physicians were. And the same thing is true with traditional Chinese medicine. And I'm starting to learn more about the herbs and everything that goes into the treatment. Ashwagandha came from India, and it's a brilliant medication. It's a over-the-counter supplement, but it helps anxiety, depression, sleep, and a whole host of other things. And there's a lot that we can learn from the rest of the world that we have stopped learning from in this country, because all these other things are natural and they're not man-made. And so we've got to get away from the man-made concept, meaning most of the anti-cancer drugs that are created around the world actually come from plants. Well, the plants themselves may have a way of doing this instead of the poisons that are created from the plants.
Absolutely. To understand for the cancer patients, if someone has a cancer diagnosis, whatever sort of
Hmm.
cancer, what are the first steps that you would, advise from your own learnings, experience, also your years as a doctor?
Well, what I would say now, and I didn't understand this until probably just before I had my own cancer, but I became more acutely aware, is stop eating sugar. Processed sugar is 6 to 8 times more addicting than cocaine, and sugar is one of the major fuel sources for cancers. Fatty acids, amino acids, glutamine can be major sources too, and you have to stop those at any given moment. But we've known since the 1920s from a German physiologist by the name of Otto Warburg that sugar is one of the major fuel sources for cancer. So my first statement to people when they know they have cancer is stop eating sugar. That's a good place to
Absolutely.
start.
It's a good place to stop eating sugar. It's a good place to start. Let us learn from your book. You are also an author. You have written a book, and then we'll come to what you are doing from at Sunrise. Help us understand
Okay.
what can people learn from your book, Dr. Harry.
Well, I hope what I've tried to do is simplify, excuse me, prostate cancer, and that's the title of the book is Cutting Through Prostate Cancer Confusion. It's a surgeon's view from both sides of the knife. And so cutting through prostate cancer confusion was really important to me. I had to break it down into the elements of what really is offered. That's what I've always done with patients is to teach them about the disease process and what we can possibly do to go through that. So I go through that whole diagnosis and the treatment with the different modalities, surgery, radiation therapy, different kinds of radiation therapy and hormone therapy, as well as chemotherapy. But so that's the book, trying to simplify prostate cancer. And so far, the people that have read it have said that it does help. There's plenty of books on prostate cancer. Believe me, it's available only on Amazon right now, but it is there. Cutting Through Prostate Cancer, is the name of it.
Absolutely. Now coming to your, you have founded Sunrise Institute for Health, Wellness, and Longevity. Tell us about this.
Yeah.
What is it doing? How can patients or anyone else can make best use of it?
Well, I hope it's going to be an educational tool as well as a platform for me to interact with people. At some point, I'm probably going to do some webinars and maybe a weekly or bi-weekly talk with people. People have started to ask me to do something like that where I can interact with 20 or 30 people at a time. But it's sunriseinstitute.com, and that'll be my platform for helping to take care of patients in different programs, as well as to interact on an educational basis with the things that I'll post there, already there, articles that I found that I wanted to write for my own education, as well as helping others to understand what's going on with their bodies.
Absolutely. Absolutely. There is so much to learn about you. There is so much to learn. And I'm sure a lot of people would want to learn more about you, about your, the way you have handled your old illnesses, diseases, as well as, learn from your book. What is the best way for them to do so, Dr. Harry?
I come back to the book can be on Amazon. Cutting Through Prostate Cancer Confusion is the book. And then sunriseinstitute.com, just all one word, sunriseinstitute.com. And I'm more than happy to interact with people there. I'm still getting the hang of all the backdoor things in something called Go High Level, so people have to be a little bit patient with me, but I'm catching up with that. And I'm looking forward to meeting people throughout the world.
Absolutely. With this, it's a wrap on this very special edition of the KJ Masterclass Live. Thank you so much indeed for joining us.
Thank you so much for having me. I do appreciate it.